Okay, welcome back to part 7 of your cardiac emergencies. Basic life support. Okay, this is what you guys do. All right, basic life support. This is you guys are the heroes. You guys are the ones that start humping chest. You guys are the ones that are cracking ribs and doing CPR for me. You guys are the ones that are sitting there dropping those advanced airways, and all I'm doing is sitting there looking at the monitor. And every now and then, I'm going to give you guys some cardiac drugs to push through that IV for me. Okay. But it requires very good BLS and defibrillation skills if you guys are by yourself. Okay, resuscitation equipment is definitely available to you guys. Okay, even if you guys do happen to go on like an intermediate and basic truck, or even a basic truck, we provide you guys, all services provide you guys with a AED monitor. Okay, do not analyze the AED in the back of a moving vehicle. Okay, the bumps on the road might see it as a heart rate. Okay, might see it as a heartbeat. Okay, make sure you guys are pulling over while you're hitting that analyze button, and it's nice and quiet, it's nice and calm in the back of that ambulance, and nobody's touching the patient, nobody's jarring the ambulance, nobody's standing up and rocking the ambulance back and forth or anything like that. Make sure you guys are in a pretty still environment in order to analyze that AED. Now, me personally, I love this slide. Okay, and I'm going to tell you why I love this slide. All right, this is hopefully going to get you guys to go out there and become advocates for your community. Okay, go out there and teach people how to do CPR. Go out there and teach people how to do CPR and AED skills. Good, efficient CPR and AED skills. Okay, I don't want it to be there and sitting around looking like a couple people, right? Looking like a couple monkeys trying to screw a football. Okay, I want you guys to go out there and teach these lay people how to do good, efficient CPR. Okay? No treatment whatsoever. You got right around just under 10 minutes until this patient's legally dead because they're brain dead. Okay? Here's the other thing. I want you to look at this. Okay? Look at this next one. BLS only. You guys, the heroes, the EMT basics, where you guys come on scene, you guys start humping chest, you guys are cracking ribs, you guys are dropping your advanced airways, you guys are applying that AED and maybe shocking if possible. Okay, BLS only. Okay, we're right about 25 minutes. BLS only at 25 minutes, and then look what happens when ALS arrives. I might buy them another 10 minutes. Might. Okay? You guys do the work. You guys run that code. Okay? I told you guys this before. You guys come in. You guys get me a patient. You guys get me ROSC. You guys do CPR. And we get return of spontaneous circulation. At which point, I have to earn my paycheck as a medic, and I have to stabilize this person from point A to point B. But you guys do the work. You guys are not just basics. And if anybody in this system tells you guys that you guys are just a basic, I want their name. You come to me. Okay? I know everybody in this system. I'll tell them something for you. Okay? I'll remind them that they were once a basic once. Okay? That they might have done something stupid before too. Okay, you guys are not just basics. You guys are lifesavers. Okay, and this slide proves it. Okay, all I'm doing is buying this patient another 10 minutes when I show up on scene. Period. Okay, so your next cardiac rhythm, also known as ventricular fibrillation. Okay, it's just the heart sitting there quivering. There is there's electrical activity going on, but the muscles are not responding to the electrical activity. Most sudden cardiac arrest deaths are due to ventricular fibrillation. This is what the automatic external defibrillator is good for. Okay? If it detects VFib, okay, ventricular fibrillation, we call it VFib. If it detects VFib, it's going to tell you to shock the patient. Okay? What they're trying to do is it's basically a Control-Alt-Delete. We are taking this rhythm, okay, and we're going to stop it. We're going to shock it. We're going to weld this patient's heart with 360 joules of energy, okay? Boom. We hit them. We shock them. What we're hoping for is we're wiping out this rhythm, and we're sending them back into a normal sinus rhythm. Does it always happen? No. But It could happen, and that's why we want to make sure that you guys are using the AED appropriately. Okay. So when it asks the question, does this device start or stop the heart? Okay. When this device does it stop or start the heart? Basically, it stops the heart, guys. Okay, we're trying to stop this chaotic ventricular fibrillation rhythm. So we might hit that button to shock them, and we're in a V-fib like this, and all of a sudden they go into asystole, and then hopefully coming back into a normal sinus rhythm. It's a Control-Alt-Delete for the heart. Okay, so there's basically two different types of AEDs. Okay, we have a fully automated, which is what our paramedics play with. Okay, and then we have a semi-automated. You guys play with the semi-automated. Okay, it actually analyzes the rhythm for you, and then you guys actually have to deliver the shock yourself. Okay, so here are the only shockable rhythms that you guys have at the EMT basic level. Ventricular fibrillation. Okay, it's just the heart sitting there quivering. Nothing's happening. Okay, it's got electrical flow through it, but the muscles are not responding. And then we also have ventricular tachycardia. Okay, where the ventricles of the heart are basically going haywire for whatever reason. Now, be careful with this, because people with ventricular tachycardia can have a pulse. If we have a pulse with what we call ventricular tachycardia with a pulse, or VT with a pulse, you guys can't shock that. Okay, you can shock the VT without a pulse. Right, so that's why we're still checking to make sure that the patient does not have a pulse before we hit that shock button. Okay, so the AED analyzes the electrical signals from the heart. It's going to try to identify ventricular fibrillation, and then you guys administer to the shock to the heart when the actual unit has advised you to shock. Just remember, make sure that you guys are checking for a pulse before you hit that shock button. Okay. Okay, guys, I skipped ahead on a slide for the monophasic versus biphasic. It's just modes, okay? Two different modes, monophasic and biphasic. Don't worry about that. Just know those terms, or just know those words. No, you don't even need to know the terms. I just want to kind of throw that out there. You guys are dealing with the semi-automated AEDs, and don't worry about monophasic and biphasic. When it comes to advantages of the AED, and please make sure you guys know these, okay? It's a very quick way to deliver a shock. It's easy to use. It gives clear instructions that even lay people that have never been trained on it can use it. I don't have to be there. Paramedics do not have to be on scene. You guys are basically doing the exact same thing that I'm doing when I hook them up to the ECG. I just can see the rhythm and you can't. Okay? The pads are actually much safer than the old school paddle back in the day. When we have a larger pad area, it's more efficient for the shocks. And again, it can be used by lay people. It's very easy to use. So some other considerations to think of. Cardiac arrest patients should be analyzed pretty quickly, but not all of them are going to require a shock. Okay, specifically remember that the AED is only looking for ventricular fibrillation or ventricular tachycardia, and remember it can't distinguish if the patient has a pulse or not with VTAC. So you need to make sure that you guys are feeling for a pulse every time before you shock the patient. Asystole, also known as flatline, means that there's no electrical activity at all. Your AED will always tell you that there's no shock advised because it can't read anything. It's not picking up any electricity. There's also something called PEA, or pulseless electrical activity. It refers to a state of cardiac arrest with an organized cardiac rhythm. So I have electricity going through the heart. It might be normal sinus in nature where I have a P wave, a QRS, and a T, but my muscles are not functioning, right? And that's something that we can play with as a paramedic, but we're still going to perform CPR just like if you guys couldn't feel a pulse on anybody else. And you guys will get more on pulseless electrical activity in intermediate and paramedic school. Okay, guys, I jumped ahead quite a few slides. Those slides are all about the actual integrating the AED and early defibrillation. You guys can kind of look over that. I am going to put this slide up. This is a great little study tool for you guys. in order to help you out if I'm going to shock this or not. So make sure you guys look this over before your exam. This is going to give you the types of rhythms. It's going to tell you if there's electrical activity, if there will be a pulse present, and if it is shockable. Yep, you guys are going to say it. You guys are going to say it loud and proud. I'm clear. You're clear. Everyone is clear before you push that damn button. And we need to make sure that everybody is clear. Nobody is touching that patient. And we also need to make sure that if that patient is in water, that nobody's touching the water. Like, let's say you just pulled this dude out of a pool or something like that, right? First of all, let's try to dry him off, and let's get him out of the water. Let's get him dried off and make sure that the puddles of water that are still on him, that nobody's in those puddles of water before you guys go and shock this patient. Remember, you guys do need to try to get this patient as dry as possible before you deliver the electrical charge, but these are just some things to consider. I'm clear, you're clear, everyone is clear. You're going to say it loud, and you're going to look around to make sure that this statement is true before you hit that shock button. Okay? We are not going to defibrillate patients in pooled water. Move the patient to a smooth, safe environment and dry them off as quickly as possible. We do not defibrillate patients touching metals. We can cause a very significant burn. Okay? So let's make sure that we're looking for keys, we're looking for belt buckles. Here in the West, we got those cowboys with them big ass belt buckles on, right? We need to get that away from them because we can cause a very significant burn. If the patient has any kind of medication patches on, we need to remove them. Make sure we're using gloves to do this, and we need to make sure that we wipe that area down with a towel. Okay, if they have hairy chests, we got to shave them. And I'm not talking like, hey, we're going to go find the shaving cream and shave them, right? No, we're going to take the damn razor that's provided with us, right, which is like one of those old school blue 30-cent a piece Bic razors, right? The demons from hell. And we're going to give them a serious case of razor burn, and we're going to start just shaving them dry. Okay? They're dead, guys. They can't feel this. Okay? We need to be able to shave them in order to remove the hair to help with the fibrillation. If we don't have time to shave them and they're really hairy, we can actually use the pads. Put the pads down, make sure they're real tight, and give them a wax job. And then put the new pads, if you have an extra set of pads, put the new pads on where you guys just wax that patient. Okay, so first off, I want you guys to understand that we do not transport dead people. Okay? We will work this code on scene until we feel a pulse. As soon as we feel a pulse, we're going to throw that patient on a gurney, and we're going to get them to the hospital. Okay? Even if we lose pulses again en route. Okay? The first time we feel for a pulse and it's there, we're going to transport. However, when we're dealing with the AED, okay, anytime that we're dealing with cardiac arrest, okay, if ALS is not responding, okay, if ALS is not responding, you are going to start beginning transport when your patient regains a pulse. Period. Okay? If you have already delivered 6 to 9 shocks on the AED, okay, that patient's fighting. Okay? That patient needs ALS. That's what that patient needs. Let's try to get them to ALS, or let's haul ass to the hospital. Okay? Or the AED gives 3 consecutive messages advising no shock. Okay? The AED gives 3 consecutive messages every 2 minutes of CPR advising no shock. If that happens, we need to consider contacting our MSEP in order for guidance to see if they want you to continue working the code or if they want you to discontinue your efforts. So when we're transporting, we definitely want some extra hands. Okay, so maybe 2 in the back at a minimum. Okay, 2 in the back and 1 driving. All right. We want to try to deliver the shocks on scene, but if we're getting high up in shocks and you guys have contacted the MSEP, you guys, and the MSEP does approve, you guys can deliver additional shocks en route. Just remember that your AED cannot analyze if your vehicle is in motion. Every bump, it's going to think it's a pulse, and it might tell you not to shock when you should have shocked, okay? And please do not ever shock a patient with a pulse. Okay, guys, I'm stopping there. You guys are going to see that I jumped ahead quite a bit. I want you guys to make sure that you guys are reading up on the actual heart surgeries and pacemakers. This is something more for your medic, but you guys need to understand that they're out there, and there are going to be a couple things from these sections that's going to be on your test, along with the LVAD, which is the left ventricular assistance device. Again, remember that this is basically a fake heart. It's acting as a pump for us until somebody can actually get a new heart off a transplant list. So make sure you guys are looking over those. You guys have any questions, please feel free to contact me via email, or we can also go over some next time we meet for class. As always, enjoy and hit me up if you guys have any questions. Take it easy.